Hello and welcome back to another edition of GNAT-TV's In-Depth series. I'm Andrew McKeever, the news director at GNAT-TV's News Project, and it's a pleasure to have you with us today on Thursday, December 2nd. Our topic today is the apparent increase in the number of opioid-related deaths and overdoses that have been occurring over the past year or so. While most of our attention recently has been focused on the COVID pandemic and issues related to that, the opioid crisis, which had shown some tentative signs of potentially at least stabilizing before the arrival of the pandemic, has been turning up some unfortunate and distressing numbers recently. Reported drug overdose deaths in the United States hit a new high of more than 96,000 people in the 12-month period ending in March 2021. That would be the 12-month period from March 2020 to March 2021, according to data recently released by the U.S. Centers for Disease Control and Prevention's National Center for Health Statistics. That represents an increase of about 29% from March 2020 to 2021. These numbers are provisional data, but clearly there's something going on here, and the opioid problem is definitely back with us again. Not that it ever really went away either. So anyway, joining us today to help us better understand what's going on here, we're really pleased to welcome to our virtual studio Julea Vadakin, who is the Director of Mental Health and Substance Abuse Services at the United Counseling Service, which is an agency based in Bennington that offers an array of programs in mental health, educational supports, and youth and family services, among other things. Alex Figueroa is the Assistant Director of Substance Abuse Services at the CDC. And Alex, welcome. Good to have you here on our program today. And also, we're pleased to have with us today Julea Larsen, who is the director of the Turning Point Center in Bennington, which is a support center to help people in recovery. Great to have all of you here with us today to talk, and I really appreciate you taking the time for this important conversation. As I said, before the COVID pandemic arrived, we were talking a lot about opioid-related issues, and tracking the what seemed to be an increasing number of overdose issues last year before the pandemic. If I recall correctly, it seemed like that at least stabilized or plateaued. But we're clearly back into a bad situation again. I just wondered to kind of get us started. Perhaps we could go around our Zoom room here and have each of you talk a little bit about what your organizations or particular responsibilities are and what your organizations do. And Julea, let me start with you at the Turning Point. Tell us what is your mission?
Our mission is to help others find recovery, so to help support individuals in their path to recovery. We work in the Southwestern Vermont Medical Center 24 hours a day. We're on call, so we go and see people in the hospital and try and help them navigate navigate getting insurance and having a safe place to live, getting into treatment, potentially getting a primary care provider, pretty much all aspects of what would make a strong, stable foundation for anyone. And then we build upon that to help individuals build tools to use in their recovery.
Okay, and Alex, I think I misidentified you there in my introduction. You are, of course, with the United Counseling Service, UCS, not the CDC. I'm getting my acronyms mixed up here. I apologize for that. But tell us a little bit about what your role is at UCS.
Sure. So again, my name's Alex Figueroa. I'm the interim assistant director of substance abuse services here at United Counseling Service. So my new role, I've been with the organization for about 3 months now, and I oversee all substance or SUD-related services. So we have, for example, one program that I oversee is called the IOP, so the Intensive Outpatient Program, and multiple other programs such as Rocking Horse, which is a peer support program. We oversee an emergency substance abuse program, and also we oversee the substance abuse block grant, which focuses on a lot of different aspects. My job is a lot of community collaboration, such as Turning Points. We're working with Turning Point, doing a lot of community outreach, community education. We do a lot of things such as education on harm reduction bags, things like that. So that's kind of my primary role, and also some grant work as well. So.
Okay. And Lori, your role at the UCS.
Before I say my role, Andrew, I just want to say I've seen some other interviews you've done, and I think you really do bring light on heartbreaking stories that have to be told. So I have so much gratitude for you for doing that and being willing to do that. And also for Julia and Alex, they are really, this is a pandemic and an epidemic within a pandemic with the substance use disorder, and they are really the front line. And I can tell you that I rely on them heavily. So I just have to say that before I kind of talk about UCS as a whole. So obviously we're a nonprofit organization, and that we really serve all the mental health needs. We have a Bennington branch, but also a Manchester branch as well. And we do really try to empower individuals, and we have a ton of programs. So we have developmental services, we have children and family services, and the goal is really to help educate and help provide support to live healthier lives. So it might mean more exercise. It might mean getting off the electronic devices. It might mean, really getting into recovery or going to rehab. But we really are trying to help people live empowered lives. And we help not just individual children, elders, but also families and couples. So, and we offer groups, we offer intensive outpatient groups, and also very specialized wellness groups. So, and really what we try to do is if we get a sense of something the community needs, and it might be one person reaching out, we will try to accommodate them by providing a group. Today, I heard that PCPs, primary care physicians, really need to be able to have groups for kids that they can refer to. So I've already started talking to clinicians about that happening in the schools so that they can redirect adolescents to feel the support. So we really try to be, and I'm going to open it up to anyone listening to this broadcast. If you know there's something that you think we could do to help this community be stronger. It's all about building a stronger community and healing people. We annually serve 3,000 people, but we want to really accommodate the need of the community. So please don't hesitate to call me at UCS.
Okay, well, so let's see if we can unpack what's going on here with this opioid situation. And Julia, perhaps I'll have you get us started here.
Sure.
What is happening? Why is this upsurge occurring now? I guess is it potentially COVID related in some way, or is there more going on than that?
So one of the biggest challenges to recovery, substance use disorder is a disconnect from family, from normal, their normalcy, going to work, having a routine. So during the pandemic, all that normalcy went away, whatever that was for people. So I think that COVID separated people where they weren't able to go out and make the connections with people that they needed to make just for their own, mental health and well-being. And instead they turned to alcohol or drugs to provide comfort during that time, which is a slippery slope, because then you're not paying your bills because you're using that money towards something else. And then, the it just compiles on each other, and it seems almost impossible. And at the Turning Point Center, we have recovery coaches that are specially trained coaches. They're peers that are in recovery, and what they'll do is sit down with an individual as many times a week as they need to. And there's no charge for our services. We don't bill for any of our services, but they'll sit down at an hour at a time and unplug each problem. You know, do you need to go to treatment? Is this something that, you know, we can handle outpatient through utilizing services like UCS's IOP and a primary care provider? You know, you got an eviction notice. Let's see if we can maybe get a grant to help you pay back some of your back rent so that you aren't evicted. So the pandemic brought along a lot of new challenges for people. We were getting phone calls early on in the pandemic that said, you know, my kids are driving me absolutely crazy. They're not at school, and I'm drinking a glass of wine by 11 o'clock just to feel a little calmer so that I'm not, you know, losing it in my household. I think it was no surprise when the alcohol tax came out, and it was, I don't want to quote it wrong, but I believe it was up by 700% during COVID. So I think that when there's a disconnect in people connecting with each other, that's a real risky spot to be in if you have substance use disorder or if you're predisposed to substance use disorder. And that, you know, Turning Point's always there to help someone. We have no judgment, and we're always willing to help. It sometimes takes a lot of courage to come out and say, hey, you know, this is where I'm at. This is what I don't have. You know, and there's a lot of guilt and shame with that. So sometimes it takes kind of a while to figure out exactly what somebody needs, because they don't want to tell you how bad it is. Some people, they'll tell you how bad it is, you know, the first time you meet them. But because of stigma and shame, a lot of times people are they're a little guarded, and we build a relationship with them that is transparent. If we say we're going to do something, we do it. And we try and help people with whatever recovery means to them, because recovery can mean something very different to you and I. Recovery to some people can mean that let's say their drug of choice was cocaine. They don't use cocaine anymore, but at night they use marijuana to sleep. And that's an okay recovery path. That's their path to recovery. They're not, you know, their life isn't being interfered with that. So it's not always abstinent based when you think of recovery. It's not always 100%, you know, people not doing anything, but it is staying away from situations that can, and people that can put you in a bad way, and also staying away from whatever your drug of choice was or the behaviors that you had. And we do a lot of work on changing the thoughts so that, you know, it changes your action, which changes your character, and we do a lot of Narcan training. And I think I'm getting a little lost out here. I can ramble. So, but that's pretty much what we want to see is people feel happy with themselves and have self-esteem and enjoy life instead of just live through it. I mean, life is a gorgeous thing, and to wake up and dread every day is not living.
No, not at all.
Yeah.
Well, Alex, let me turn to you and just sort of ask you, what are you seeing in terms of this uptick, which I assume is nationwide? Correct me if I'm wrong, not just certain states here or there. What are we seeing in Vermont, and in particular in Bennington County? Are we seeing the same kind of spike in terms of overdoses?
I mean, absolutely, and I definitely want to give kudos to our partners at the state level, ADAP. They are the Vermont Health Department's Division on Alcohol and Drug Abuse Programs, and they've done a great job of really providing data and resources around overdose fatalities and non-fatalities as well. And so, a lot of the data that we'll talk about in this meeting is really going to be from ADAP. That's our general source of information that we tend to pull from, along with the CDC as well. But as it relates to Bennington specific and the state of Vermont, looking at just the 2021 numbers, as of right now, we have a total of just through and keeping in mind the data for October and November hasn't been made available yet. But just through September, I mean, Bennington already has 11 fatalities compared to last year of 2020. There was a total of only 8 fatalities, right? And so just within that, and we still have October, November, December left in the year. And so we've already exceeded the number of overdose compared to the previous year. And so, and I think there's a lot of different reasons for that. I know Julia touched on it a little bit. When the start of the pandemic in 2020, we were living normal lives. A lot of folks, right, are being social, and folks that are in recovery, they're attending group, and once you cut all that off, what happened? I mean, the whole community shut down, the whole state, the country shut down, and when you lose that social connection, that impacts our day-to-day lives. And so, I think, and that affected, folks that were in treatment, affected them individually. And, you could even look at, whether it's from overdose related fatalities or something that's not even talked about enough is the increase in alcohol use. The numbers, you can obviously go online and look that there's been a huge increase in alcohol sales. We're starting to see a lot of folks self-identify with the alcohol use disorder. And so that's just something to kind of keep in mind. And because of the pandemic, that played a significant role. And that's because of that social isolation piece. Mm. And not having that sense of connection with peers and providers and whatnot.
Lori, I was wondering if you could talk a little bit about that what point that Julia was making there, the stigma side of it. That's a term that seems to come up an awful lot in conversations about opioids or alcohol abuse. What exactly is meant by that?
Well, I mean, I think, here, there's benefits to being the old person in the room. And one of those benefits is that, you can see patterns of things that kind of unfold. So in the 1990s, I was running a group here for adolescents, and the group was for kids that had been identified for using alcohol or cannabis. But what happened is during the time I was running the group, kids started talking about taking their parents' painkillers that were prescribed to them by the doctors. And I remember being really alarmed by this, like, hey, you don't even know what it is you're taking, right? You're in a different class drug. This, and then I watch it unfold. I watch it instead of, joints being purchased at the high school, it was now pills being passed around. And then I had the opportunity to continue to work in the field and see that, unfortunately, now we have this opiate addiction and so people have to be able to treat the physiological need for that, and then they turn to heroin. So then we see it progress, and of course heroin is much more dangerous, right? So then we see in the last few years that there's this synthetic, which is fentanyl, and it's highly poisonous, really dangerous, but it's cheap. It's really easy to get, and unfortunately, it's the progression of the disease of addiction. And so I've watched it unfold. I've tried to get ahead of it, as all of the providers in our community, all the providers, out there trying to figure this out. And so I think what happens with stigma is that people are afraid. And so when people are afraid of something, right, it's easier to look at it as that problem. Look at that person, they have a problem. The reality is it's all of our problems, right? I don't know a family that has not been impacted by addiction. I just don't. And so I think, when I think about like stigma, the best thing we can do is educate ourselves, right? We can protest and start to understand, like, this is no one's fault. Like, this is, opiates change the pleasure site of the brain. So, unlike cannabis and alcohol did, right? So unfortunately, they're forever chasing that high to just feel normal. And so I think that, and to Julia's point, that's the same, that early morning drinking, that recovery drinking, you're just trying to chase that feeling of feeling normal again, right? You never intended to have your one glass of wine turn into a bottle of wine, right? And so I think compassion, love, understanding, right? I think it's important how we talk about addiction. It's substance use disorder. Julia can talk a lot better about the importance of how to talk about this. But I think education is primary to be able to protest, to be able to correct people. If they're saying something that's discouraging or unkind or judgmental about someone that's struggling, I mean, we are all doing the best we can. I think people in recovery are doing the best they can. And you're right, Julia, a lot of people are not turning towards total abstinence. It's harm reduction. It just, it's a hard thing to negotiate, and they're just trying to get through life, right? So I think that we do have to be conscious about our language. I think that the best thing we can do as an ally is when we hear judgmental things, that we correct people, we talk about it differently, and focus more on the positive, what people are trying to do to get themselves well. The services that we have in this community and the biggest hearts are in Bennington County. I have to just tell you.
So the quality of the heroin that's circulating around through Bennington County, Vermont, I suppose the rest of the country by and large, is of a higher quality, if that's the right term, or higher potency than was the case a couple of years ago. Is that?
Well, the synthetic opiate is, the manufactured synthetic opiate is called fentanyl, and I think there's now 2 other strains I've heard, but it's highly toxic. And Julia and Alex, I'm sure you have more wisdom than I do around the potency of that, but that is where we're seeing. So people are going out, they're buying a $10 bag, and unfortunately never intending to overdose, never intending to do anything other than to just soothe the nervous system that they've now changed because of their use, right?
Mm.
Yeah.
And also, I think it's really important to point out, sorry to interrupt you, is that a lot of times it's there are pills that are made in pill mills that look like a Percocet, look like a Xanax, look like an Adderall, and really they're fentanyl-laced eyeshadow pushed together to look like a prescribed medication. And when you look at them side by side, you can't tell the difference. So you don't know anymore what you're buying. If it doesn't come from a pharmacist, and you buy something on the street, more and more drugs we're finding fentanyl in. Brattleboro just had its first overdose fatality. A young gentleman who smoked marijuana that was laced with fentanyl. Fentanyl is very, very inexpensive. It can actually be bought you can buy it on the dark web, but it's just it's Narcan resistant, and it comes in so many different forms. And the drugs that people are getting these days aren't what they're getting. Right now, crack cocaine is sometimes crystal meth, so people don't realize. And I think there's a benefit to the dealer because you're creating a customer who's now chemically dependent. They have to come buy that weed from you. They have to come and buy that Xanax from you or that Adderall from you, because if not, they'll go through opiate withdrawal.
Mhm.
So, unfortunately, I think the thought is that, oh, I want, I know locally the thought is that I want to sell this to you and you might die, because that's not what people think. But I think on a much larger scale, I don't think that they care whether people live or die, as it's about money. And it's really, really sad. And I think the more that we're aware of what can be in fentanyl, it's just important to be educated about that.
So I guess I'll throw this out to all three of you here. Well, maybe I'll ask Alex to lead off. Once the pandemic is, I don't want to use the wrong word here, at least we finally might have turned the corner and there won't be another variant of some sort or another coming up. Do you think that some of the impetus for this upsurge in opioid abuse is going to, sort of minimize again, or will we be sort of so locked into everything at a higher level that it's just going to self-perpetuate?
Yeah, I want to be mindful of how I word this. I think what we're seeing now, and if I had to put my crystal ball on and project, 2 years down the road, I think one, folks that are either in recovery or suffering from an addiction, it's not just opioids really anymore. I mean, there's a lot of polysubstance. Whether it's prescription drugs or fentanyl or heroin and fentanyl. The one thing that was when you look at the reports from ADAP, what's an rising drug is methamphetamine and fentanyl. Yeah. And so there's a lot of polysubstance and alcohol use. That's one that, again, as I mentioned earlier, doesn't get talked about enough, and I believe it should, because a lot of folks are also mixing prescription opioids and alcohol, and throw fentanyl in there as well, right? So, in 2 to 3 years, my fear, we're going to see a lot of folks start to kind of identify with having a substance use disorder, or I should say substance use disorders. That would include alcohol use disorder as well. And so, I'll be honest, because we're already seeing it already, and it's towards the end of 2021. And here we are, right? It's going back to mask mandates, and we're heading into the winter months, and already living in a rural community. Again, going back to that social isolation piece, where what happens when you are isolated? You tend to kind of gear towards that one thing that makes you feel comfortable, and that's drugs or alcohol, and so. It'll be interesting to see, what those numbers look like in a couple years. I'll be honest, I definitely, based on the current numbers, I think it'll be much higher next year than this year. I'm hopeful and praying that it's not the case. But when you're comparing already 2019 to 2020 to 2021, the numbers are just steadily increasing. And so.
And what about the availability of treatment? My understanding is, and you folks correct me if I'm mistaken here, is that there's a real shortage of beds and treatment facilities in place to help folks who have reached the point where they say, "Hey, I need some help to break out of this cycle." Are those resources available in the quantity needed, or not? I don't know who wants to take on that one. Maybe Julia, I suppose perhaps at the Turning Point, you probably deal with this question a lot.
I can tell you that it's absolutely heartbreaking to see somebody come in completely ready to go to treatment and to not be able to find a treatment bed, or have a week-long wait. Um, Valley Vista in Bradford is now a men's unit, and they have a women's unit in Virgins. But that did put us at a slight disadvantage for women beds in the state. You know, we need more treatment centers, and we need more partial hospitalization / treatment, so that people can come during the day, but they can still go home to their apartment and they can live life on life's terms while they're getting well. You know, Bennington County is going to have some recovery housing going in, which I think is a great step. You know, you leave treatment, and then if you're going back to the same situation, your chances aren't as good as somebody that has supportive living. But treatment-wise, you know, to be honest with you, we send a lot of people out of state because we can get the bed quicker. So I think Vermont has done a great job. The Department of Health really has, like, with the No OD campaign and Vermont Help Link. But I would be so grateful if they would open more treatment facilities, whether they were, you know, day treatment centers or inpatient treatment centers where someone stayed for 30 days. It's something that we really, really need. And unfortunately, I think that when the pandemic of COVID is over, I think our country is going to realize that we've been in a pandemic of enormous proportions from substance use disorder this entire time. So I feel like we're in the middle of two pandemics. And hopefully, you know, we'll be able to look at all the things that we're missing and provide funding and resources and places for people to go to get well.
Mm.
And Andrew, if you don't mind, I'd like to add
Sure.
one thing. You know,
Absolutely.
and to Julia's point, I think the one thing that often doesn't get that gets missed, you know, staffing in a lot of these treatment centers has played a significant role as well. You know, in staffing in terms of, you know, because there's obviously, as we know, across the spectrum, there's a workforce shortage, you know, in healthcare and human services and trades, right? And so I think the pandemic also has kind of, you know, I think just kind of influenced that even more, where, you know, there's a lot of, you know, organizations that are again offering, are hiring, but no one's taking on those jobs. So, and that plays a significant role. You know, when you might have a treatment center that, yeah, they have the beds available, but they can't fill them because they don't have the staff for it. And so that adds another layer of complexity as well.
Yep.
I was going to ask, you know, how do you break through, or is there a way, a technique of some sort, or techniques to kind of break through to people who are struggling with an addiction, who kind of are at the point that they realize that they have an addiction and a problem, they don't like it, it's not who they are, or doesn't match up with their image of themselves. Is there a process? I mean, does it depend on the person to kind of take the first step to come into, you know, to talk with one of you folks and say, hey, you know, I'm just at my wit's end here, or is there, you know, something else that can happen to kind of bring that person into a recovery cycle?
Well, the one thing I know for sure is that the people that I've worked with, and I've worked with many people over my career, is that they love their families. They really do love their children. They love their families. So I would really say to them, you know, as you struggle through this, you know, make sure you get your kids in Head Start, or that they're seeing a school counselor, and to start to change your mantra that maybe you can do the next right thing for yourself. And that might mean just not picking up that day. That might mean, you know, calling emergency services. It might mean, you know, trying to find a substance abuse counselor, or just, you know, come in for, you know, just a meet and greet to to know that we're here. And the thing that we try to do is meet people where they are. And, and Julia does a great job with this too, really just aligning with what their truth is. And it takes, everybody's path is very different. And so it's learning to just attune to them and accompany them on their journey. And it gets to be their pace, their rhythm and pacing. But we do have we have youth services here, we have psychiatric services here. As we talked about earlier, mental health services are broad, and we offer as many things as the community needs and asks for. In January, we're going to be opening FAST. So FAST is find access to services and treatment. So the day you walk in, we will provide a service for you. So there's no wait at all. We're very excited about this starting. And I think, so for that person that in that moment, today is going to be the day, right? The new year does that for us, right? So as we try to figure out how we're going to lose weight or exercise more or, or quit smoking right, just know that we're going to be here and we are going to welcome you without judgment.
Okay. Julia, I didn't know if you wanted to build on that a little bit. I would imagine that you must have lots of conversations with people who've kind of gotten to a point where, hey, I don't want to be doing this anymore, but I'm stuck. And how do I get out of it?
Yeah, it's really a privilege. It's really a privilege to be part of somebody's recovery journey. To have them trust in you with what they tell you and be able to provide resources and referrals. And we also do family coaching. So I'm a certified recovery coach for families as well. So a lot of times I meet with individuals and their families, and we come up with plans all together. We know that if we try and make somebody do something, it's not going to work, right? But the old intervention idea of everybody sitting down and saying, hey, you won't have a house, you won't have a car, we're not making you a tuna fish sandwich unless you go to treatment. Those kind of things don't work. So, it's really just an unbelievable process to watch someone grow from, not having a place to live, having food insecurity, having just the clothes on their back, having absolutely not one friend or family member that'll talk to them, and to come in and work on themselves and their life at the rate that they're willing to go, and to be part of that and suggest things and help them with different resources. Now I have people that are in college that have, they actually own their own homes. They have their children back. It's really just an amazing journey to be a part of. It's really a privilege to, and people can say, well, how don't you feel judgmental, and it's more about that whatever's happened, right? We can leave yesterday and yesterday. What I'm worried about is today and tomorrow. Let's work on today so that your tomorrow is better than it was yesterday. And I think by being non-judgmental and transparent and just kind, this is a large group of people that the community at large isn't necessarily kind to them. They're often victims of abuse, either in early childhood, domestic violence, or as a result of their substance use, they become victims of sexual or physical violence. And I just think that, these are other human beings. We're not talking about something you can replace. This is somebody's, brother, sister, mother, whatever the case may be. And it's just wonderful to watch them find their path to recovery and help be part of that path. And then see a a grandmother come along, and it's amazing. It really is amazing to see. So, as much as I like being the executive director with all the paperwork and things that I like, my favorite part of my job is direct service work, and also having large discussions with people that don't want to hear about substance use disorder, because I'm not afraid to stand up there and tell them that the language that they're using is wrong, and that we can all get along a lot better if we're just kinder to each other. So,
well, Alex, let me turn to you. I guess I was wondering, what do you see the role of law enforcement in all of this? I mean, I've heard it said that some people are kind of, they get a little concerned about either coming forward and talking about some of these issues because they're afraid they'll get, on the wrong side of some legal statute and go to jail. Is there a constructive role that law enforcement either currently plays or can play in the whole process of trying to stem this opioid surge and help people overcome their addiction issues?
Yeah, I think Julia could probably speak to this a little bit more, but the one thing that I will say, our law enforcement, and this would be actually a good conversation to, next time you have one of these talks, to invite someone from law enforcement, because, our law enforcement partners are amazing. They've been great. Throughout the last couple of years, UCS, Turning Point, with partnership from the hospital, we've developed, programs to really help kind of better support folks that end up having an overdose fatality or overdose in general. And so I think, Julia, I'll let you speak on that a little bit more. I think it sits more in your wheelhouse. But one thing I will say is that, in terms of law enforcement, we have great relationships and partnerships. We have our partners from HIDA. They are the High Intensity Drug Traffic Agency that, we work closely with as it relates to, different drug trends that are kind of, being trafficked all throughout the state. And so, and they partner with local law enforcement as well. So definitely, a lot of collaboration, a lot of connecting.
All right. Well, Julia, over to you, I guess.
Well, we currently have a program that is the Outreach for Overdose Project, and we have recovery coaches on call 24 hours a day to respond to, to respond to overdoses with law enforcement. Usually the person that is overdosed isn't aware of what happened, so they might not necessarily be ready for a change. One of the things you asked Alex was about law enforcement. During one of those 911 calls, everybody in the room is covered by the Good Samaritan law, so they can't be charged with drugs, drug paraphernalia, anything that's going on as a result of trying to save someone by using 911. What we do see on those calls is people that witnessed the overdose might have overdosed multiple times throughout the year, but they'd never seen what actually happened. And that terrifies them enough to want to get help and get into treatment. And we've had more success with bystanders than we have had a couple successes with individuals that were called as the 911 original call. But it's usually the person calling 911 that, had to do life-saving measures and give someone Narcan and do rescue breathing and witnesses the trauma of somebody being brought back to life. So we have more engagement from bystanders.
When I'll just talk maybe about heroin for a second. When people, ingest heroin, whether, however they do it, I've heard it said often that it's always a good idea to have somebody else with you, so that if you do overdose, somebody could administer Narcan or something. But
Mhm.
do a lot of folks who are struggling with addiction, do they actually do that? I mean, or is it just that the urge to kind of get high and, kind of alleviate whatever anxieties or feel normal, they can do that. They just say, hey, I'm not waiting for my buddy to show up here. I'm
So starting December 1st, Turning Point will have a phone that will be through a schedule. Different recovery coaches will answer this telephone 24 hours a day. And basically the person can use the substance while the recovery coach is on the phone, but they'll have all the information of where the person is. So they'll give their address, what room they're in if they're in a hotel. And then the recovery coach will talk to them for 15 minutes after they've used the substance to make sure that they're okay. If they stop responding, then the recovery coach will try and keep the person on the phone and call 911. So that started December 1st. I think that a lot of people do our harm reduction efforts, even though the fatality numbers are up. I can't imagine what they would be if we weren't doing as much harm reduction as we are. Our harm reduction efforts are up by about 300% from 2020. So if all that Narcan wasn't in the community, I can't imagine how many fatalities we would have. One thing I would like to say is we put extra Narcan in our harm reduction kits because Narcan is fentanyl resistant. So it does take sometimes 3, 4, 5 doses of Narcan to bring somebody back to consciousness. And that's not even being fully medically stable. That's just, being able to have a respiratory rate of some sort.
Yeah, and the one, Andrew, and I'll add to that too, just because I think it's and thank you, Julia. The state, and it's something that I'm looking at into our program is really having the conversation more around overdose prevention techniques. I know the state I think recently launched a No OD campaign. And it really talks about 5 different strategies on essentially kind of that harm reduction component, right? And like you already alluded to one of them, avoid using alone. So whether that's with somebody else, testing the drug of choice that you're going to be using for fentanyl, because we know fentanyl is a huge piece, component of life. Folks are suffering overdose. Go slow, and then obviously having the state they provide harm reduction bags to recovery centers such as Turning Point. We also get the harm reduction bags that have naloxone or Narcan. So obviously having Narcan on site, and then obviously making sure you're calling law enforcement, call 911 if there is a suspected overdose. So that's something we don't talk about enough. We should talk about it. Harm reduction is I think still very new. It's a new term to many people. And so, but I think, we're starting to see it more, and I think we need to talk about it more as well. So just wanted to add those key points as well.
And I just wanted to say one thing to what Alex said. Harm reduction is a form of recovery. So you're not always necessarily fully recovered from every single substance. But if you're working on harm reduction, you're putting yourself along the path towards long-term sustained recovery. So I just think it gets lost. It's in prevention. A lot of times they'll say, well, harm reduction is prevention, which it is, but it's also a stepping stone to recovery. So it's just as important to talk about as recovery is. And I think that brings a little bit less stigma. When you start to say, hey, I understand you're not ready to quit today, but can you quit, or, can you use in a way where we're not burying you tomorrow? I think that's helpful. That I know that people have said, I feel like you care more about my life than I do, because you're telling me to do all these things, and those are things I never thought to look up. I just figured if I died, I died. So I think it's just really important that harm reduction is talked about in prevention and in recovery.
Mhm. Well, we're just about out of time now, but I wanted to let Lori have one last word in here. Lori, are you seeing any light at the end of this tunnel, or anything that suggests, as we started to see, I think, in 2018, 2019, the level of opioid overdoses sort of stabilize? Any suggestion or any scenario that you're hopeful to see, in a year or two, where this upsurge will also begin to subside a little bit?
Well, I have to say, I feel really moved by this whole interview, and I'm so grateful. Julia brought me to tears, I have to say. I know firsthand how you saved lives. I know how, Alex, I know how the IOP has saved lives. So I'm just so grateful for this opportunity. And I do think there's hope. And I think, I talked to a desperate mom yesterday, and of course I referred her to Turning Point. And the best thing you can do if someone you love is using substances, provide information for them, education, and then you yourself get help, because the hardest thing about recovery is you can't take people with you, right? So people have to say, I want this for myself. But if they know the things that are available, and like I said, United Counseling has so many services for children. So if you're struggling, at least make sure the loved ones are in treatment. And then when you're ready, we're here with open arms and no judgment. So I do feel hopeful, and we do have the most compassionate community. And I have to agree, ADAP has been really, truly, since I've been the director here, have been on my speed dial. And they are accessible. They've helped create Help Link, which really links people up to Turning Point, to UCS. And I feel very hopeful for the future.
All right. One last other point I meant to ask about was opioid addicted children, babies who were born 5 or 6 years ago. That was a major concern around here in Bennington County. Has that gotten a little bit better, or is that also ticked upwards along with the other indicators?
Well, we've gotten smarter, right? And I'm sure others can talk about this as well, but we have services now. So the Department of Health has services where, they have supports for pregnant moms that are using substances. Rocking Horse, which Alex talked about earlier, is specifically a support group, peer support group for moms to come together that are pregnant and are struggling with addiction. So there are services. The hospitals are, I did ask for the hospital to provide me some information, so I might actually be able to get that to you, because I was just curious about numbers. I think you can find those numbers, though, on the Department of Mental Health website if you want to take a look to see what the numbers currently are for babies. But I do know that we're trying to provide education and support.
All right. Well, we're going to have to leave it there for today, but I wanted to thank all three of you again for making the time for this conversation. Certainly extremely important work you're all doing in this very difficult area. But Julea Larsen of Turning Point, Alex Figueroa of United Counseling Service, and Lori Vadakin of United Counseling Service. Thank you all very much for your time and the work you're doing. And I obviously, if someone's listening to this and thinks they may have a problem, they now have some resources to work with, or at least know where to take that important first step. Thank you again. And thanks to all of you for being with us for our program today. I hope you found it interesting. We'll see you again the next time. Meanwhile, have a good day. Take care.